we'll be talking to a lady who is the founder of Reach Out World, and she is doing some amazing stuff. And well, she goes by the name Naa Plange. I got it right?
Yeah, Priscilla Naa
Priscilla Naa
Plange.
Plange reminds me of some food joints in my area.
Right.
Good morning and welcome. How are you doing?
Good morning. I'm okay. How
Great,
are you?
great. I'm good. Good to have you.
Thank you.
Reach
Thanks
Out
for having
World.
me. Reach Out World mission.
Mission.
Yes.
What's the mission?
To give back to society, to create smiles, and to make an impact, to leave a legacy of help, to create a ripple effect of positive change. Yes, and we've been at it for the past 10 years.
Okay.
We're actually 10 this year. And our focus are on SDGs 1, 2, 3, 4, and 8. So all our projects are either working towards ending poverty, promoting quality health, promoting education, or promoting decent work and economic growth.
Okay. I mean, usually when I speak to people who are doing things like this, it's what's the motivation? Because a lot of people will be doing, people have their works that they do, and you choose to do this. What's the motivation really?
I started, let me just come at it from this angle. When I was younger, I wanted to always start an NGO and then build an orphanage, build a homeless shelter, work to support youth. But then I was like, let me just wait. When I'm 60, when I am retired, then I'll do that. Then I had an accident in 2013 on my hospital bed. I'm like, you know what? This is a near-death experience. Why wait? Why not start now? So I spoke to a couple of friends, and their support was massive. So we had our first project in January 2013. And we've had over 15 projects, impacted over 9,000 lives in 7 regions of Ghana. We've won awards, we've been recognized globally, and it is more motivation, yes, to just continue impacting lives. It's just beautiful when you see somebody years after, and you know that, okay, you contributed, you and your team, we all work together to create that ripple effect of change. And when you impact somebody, it's a direct impact, but then that person has dependent. So you impact one person, but indirectly you are impacting a whole family, 10, 15 maybe. And that's something that you should always do. I think everyone should just have a way that they give back to society. That is how we would all just go. Continue helping each other to cross the bridges and bridging the gap between those who have so much and those who really need so much.
Wow, that's really good to hear. But with these works that you do, you need funding, you need to definitely put things together and help others. How are you doing that?
I have a beautiful team of volunteers and members who give to support. And then we always do public fundraising, social media fundraising, crowdfunding. We send letters to organizations whose goal align with that particular project that we have. It's not easy, trust me. Sometimes you have a project and your budget is about 30, 40, 50,000 and you're wondering how is it going to be done? But for me, I believe once you just commit everything to God, things just fall in place. Things just always fall in place. And that has been one major factor. God has always been with us. And I'll take this chance to say thank you to everybody who has supported us, even with one person, with 100,000, with 200,000, anyone that has supported us to get to where we are today, we say thank you.
Okay, that's great. For last year, 2022, take us through some of the projects you worked on, and then now, as we are in 2023, what the plan is.
Okay, so let me just say over the past 10 years, we've been having street outreaches, we've been having medical outreaches, we've been working to train and support youth. We have social media programs. It's like we work with the SDGs, and then there's an annual children's program that we do called the Laugh Fair. And we do that, we focus on street children and orphanages. Okay. So our impact is children, youth, and adults. So each project that we do, I mentioned that we've done over 15 projects. Each project that we do has a particular focus, and some of them are in series. So for example, what we are going to do in the Upper East, it's not the first time that we are doing it. This is going to be about the 4th time that we are doing it. It's in sessions, and we do it in different regions and rural areas. So this year, we are going to the Upper East region. We've been to the Upper East region before. We were in Bogatanga, and we do this particular, we used to call it charity breakfast. Then we changed the name to community medical outreach. It started by saying, you know what, why don't we go to a community, work with the people in the community, let's work with the women, let's cook, and let's bring everyone together and let's do a free medical screen. So because of the cooking bit, it was called charity breakfast. But then we were like, you know what, why don't we expand it to more than just eating and then just a medical screen? So we added a vocational outreach to it and an educational outreach to it. And now this year, by God's grace, with partners, we are adding surgeries to it.
Wow,
so in the Upper East region, thank you, the Upper East region, in collaboration with, I'll mention the partners later, are going to be doing 100 surgeries for people suffering from hernia, cataract, and then fibroid. Maybe you ask me, why these? You know, based on feasibility studies that we've done, there are people on standby who need this. And according to the Global Health Report, the 2022 Global Health Report, approximately 5 billion people worldwide lack access to quality surgical care. And Africa, this percentage is largely populated here. You know, we work with different, medical organizations. We ask questions and realize that, there are many people on standby in the Upper East region who do not have the money to be able to pay for the surgery that they need. And, these surgical conditions, as you don't take care of them, it gets worse and worse and worse over time. And I don't know if you know about hernia, but you know how painful it can be. So a father who has probably 5 children can't go to work to take care of his kids because he's suffering from this condition. These children may drop out of school. They may not have an efficient childhood that they should have. So this is an indirect ripple effect of what he has. That condition is impacting his children. And if they don't get the quality childhood that they need, they grow up and then they are not able to even take care of their kids well. So we are thinking beyond, what can we do to support these vulnerable populations? So in collaboration with the Kasina Nankana Doctors Association, the War Memorial Hospital, the Upper East region, Ghana Health Service, the Mandela Washington Fellowship alumni, and a few other organizations which we are yet to confirm, we are doing this 100 surgeries for free. Wow. It's for free. You are not going to pay anything
for it.
It's for free. And we are also working with a member of parliament for Navongo Central to make this happen. And we are doing free medical screen for 900 more people. And we are doing vocational training in bead artistry, how to make beads, bags, shoes, slippers for 50 selected women. And then we are going to pick a school in the community and do an educational donation to them. So it's a holistic approach.
For everything.
Yeah, that's
as you're helping them with the health, education comes in, and also entrepreneurship is something that they could do with themselves. I've got a few minutes to go though. What are you asking people to do to help with this? When is this actually also taking place?
This is happening in Easter.
Okay.
So the surgeries are going to be happening from 29th March all the way through to 6th April. And then the medical outreach and then the vocational outreach and the educational outreach are going to be between 6th and 9th April. So we have approximately 70 days to go. What we are asking for volunteers, we go with 2 buses of young people who are willing to just connect with each other and give back. It's a very fun experience. So anyone that is watching that would like to join us on this trip should contact us. And then we are looking for partners and sponsors. Okay. We are looking for partners and sponsors because doing 100 surgeries for free is not a joke.
Yeah, we'll come at a very huge cost on the other side. Yeah.
Exactly. So anyone watching, partnership can be, or sponsorship can be monetary or via items. There are many items that we need for the medical screen. So anyone watching, any company, pharmaceutical companies, we are taking letters around. We are looking for partnership, even to bus our volunteers and everything, yes. So, so anything that we can get to add to this, we really appreciate.
Okay, so any number, where can people find you?
You can, on social media, Instagram, Twitter, Facebook, Reach Out World Mission. Okay. Yes, exactly. And then our website is on maintenance right now, but it's www.reachoutworldmission.org. Okay. Even if you Google Reach Out World Mission, you find us. Yeah. I'm going to give a number so anyone can call me. Yeah. Can I do that?
Yeah, sure. So
it's 050-393 6000. It's available on WhatsApp, on text, on call right now. 050-393 6000.
Okay. Priscilla, thank you so much for coming.
Thank you so much.
Wish you the very best. And God bless you for all that you're doing.
Thank you.
Yeah, yourself and your team. That's amazing.
Thank you. Yep. Thank you. Thank
you
for having us.
So people, you've got to help out whichever way that you can. We need to help people. That's what it is. So that was Priscilla Naa Plange, the founder of Reach Out World Mission, talking to us about the upcoming stuff that they'll be doing in the Upper West region somewhere during the Easter celebration. So please do help out. Check them out on social media on all platforms. Also, so this is where I get to wrap up on the show for today. Many thanks for joining me here on the Morning Rush from 5:30 a.m. right up until now. Thank you. It's Monday. I know sometimes the energy is not right, but get in there with all the energy and go through the week with it. I'm back here tomorrow, same time, 5:30 a.m. Big shouts to the production team led by Josiah Tope. Up next is Good Morning Ghana. My name is Desmond Okrekudan, you can call me Desi Fading, the Star Boy. Remember to dream big, shine bright, and sparkle more. I'll be back tomorrow. Have a great day. Bye-bye.